So let's talk about acne and diet. This book was written in 1885 by a physician in New York City, and he has a lot to say about how diet affects acne, so we'll go and take a look at it. Here he says, there is no question whatever that proper diet is of the greatest importance in the management of acne. Here he says, the patient with acne has, in the vast majority of instances, committed errors of diet and is still committing such, which, if they do not render the disease incurable, certainly retard its removal. Here he talks about how sugar causes acne. The clinical observation is continually made by patients that each overindulgence in sweet substances will be again and again followed by the new development of the elements of acne. It is essential, therefore, to avoid candy entirely, and also such rich and purely sweet articles as honey, syrup, pound-for-pound sweetmeats, and the like. Ice cream generally proves more or less injurious. Here he says that fat is okay and recommends cod liver oil. This, however, is not the case, and very frequently the eruption will be more benefited by increasing the oily portion of the food as by the addition of cod liver oil than by any other single means. Here he warns against fried food. This is most markedly seen in those instances where animal or vegetable matter is fried in fat. Fried oysters and fried eggplant are, perhaps, the most typical which could be mentioned out of the many articles which are liable to be taken. And here he warns against bread and pastry. With such fried things must also be excluded griddle cakes and all hot breads, or bread less than 24 hours old. Pastry also, in all its forms, is exceedingly injurious, and the use of even the smallest amount of it will sometimes be attended by an outburst of acne. And he goes on to give a list of foods which aggravate acne. Such are nuts of all kinds, cheese of the richer varieties, chocolate in excess, bananas, and some of the more indigestible vegetables, as sweet potatoes and cabbage. Salted meat and fish are also to be restricted in these subjects, but fresh fish and shellfish have no effect in producing the eruption and are rather beneficial. Oatmeal is not infrequently found to aggravate an eruption of acne. Here he talks about tea and coffee. Tea and coffee are often thought to be injurious in acne and are avoided, but in at least half of the cases, they may be taken in moderation without disadvantage. I found this rather odd. It seems that there's a theory that drinking ice water at a meal disrupts digestion, and he warns against this. On investigating cases of acne, it is sometimes surprising to discover that the amount of iced water which is drunk by some patients thus affected, frequently, as they recognize, to their very great detriment, causing the eruption to recur again and again. In order to avoid the drinking of water with the meals, it is often desirable to administer hot water half an hour or an hour before eating. Again, on the theme of digestion, he warns against drinking milk at a meal. He says, few adults can take milk in conjunction with other food without producing, sooner or later, the state of system known as biliousness, and it is better to entirely cut off milk as a drink at the meals during the treatment of these cases, or indeed permanently. On this theory of digestion, he says that milk can be absorbed from the stomach directly, like other fluids, without ordinary digestion is probable, for reasons which appear physiologically and clinically. He says of milk, it should be drunk alone, and under no condition should even the smallest particle of food or anything else be taken into the stomach within half an hour or an hour before or after the milk. He says, alcoholic drinks are injurious in all of the varieties of sebaceous disease, and unless strong reasons exist to the contrary, they should be absolutely interdicted to patients suffering from these disorders. He says, meat should not be taken in excess by acne patients with the idea of giving strength, for it is frequently found that these patients do better with a moderate amount of meat is taken, not more than twice a day. Pork and veal should be interdicted, also the richer portions of poultry, stuffing, gravy, and the like. Nor is starchy food to be taken in excess by these patients, for oftentimes it will be found that an acidity is developed by an excess of this class of ailment, which aggravates the existing eruption and causes the development of new lesions. So some of the recommendations about diet and acne make sense, some less so, in part because they're based on outdated scientific theories. If you want my help for diet and acne. You can click the link to book a consultation call so we can get started. Thanks.